We begin tonight with vaccine hesitancy. It is an issue we have been talking about all year, an issue many of you have been quite vocal about.
We asked unvaccinated Central Georgians on Facebook, why have you been hesitant? Kelly commented, because it doesn't stop you from getting or spreading the virus. It only stops you from dying from it. Jamie said it's because of the conflicting stories they've heard. And Cheryl added, because you don't know what or who to believe.
Tonight, a Houston County woman says she had a change of heart and is now waiting for her second dose to be fully vaccinated.
But her experience so far has been a unique one. Kayla Solomon joins us in studio with more.
Yeah, Frank and Lori, Tamara Byram says she didn't want the vaccine at first. And then last Thursday, she started feeling some COVID-19 symptoms. She went and got her first dose of the vaccine the next day. Today, almost a week later, she received her positive test results. She shared with me her journey from being scared to get the shot to rolling up her sleeve and why she's now a vaccine advocate.
Thursday evening, when I started to eat my dinner, I was like, I can't taste this. You know, there's no seasoning. I mean, it just was nothing.
That's how it started for Tamara Byram. She says she was already planning to get the vaccine, but knew she had to do it sooner once she lost her sense of taste, smell, and felt fatigued.
My symptoms they're kind of subsided, but my taste has not come back and my smell has not come back. Not yet.
Although her symptoms subsided, Byram says she's glad she took action when she did. But like many Americans and Georgians, she was hesitant at first because of the FDA not fully approving it yet and her current list of daily medications. That's until she thought about Riley, her granddaughter.
I have a 4-year-old granddaughter who is in pre-K now. And with the children going back to school and everybody being kind of in contact and, you know, the whole mask thing. And, you know, I just didn't want to be in a position where I couldn't be involved with her schooling or be involved with her at all.
Byram says getting the vaccine was emotional.
The thing that got me was once that needle went in my arm, I cried. And I cried because what it did was it brought it to reality.
And now she's urging others to roll up their sleeve like she did.
When you do get it, you don't know how it's going to affect you personally. And I know that's, you know, was a question in my mind.
Byram is set to get her second dose of the Pfizer vaccine in 3 weeks. Back to you.
Central Georgia healthcare leaders united today with a clear message: get vaccinated and stop spreading misinformation.
Education is one of the cornerstones of public health, and sharing facts with people can only help them make an informed decision.
Leaders with Houston Healthcare, Piedmont Macon, Atrium Health, and the County Health Department met in Macon. They discussed the impact of the fourth wave of COVID-19 in our communities and its impact on the healthcare system.
At Houston Healthcare today, we have 85 patients. Just a short month ago, that number was 7. So the spike has occurred. Numerous of those patients are in critical care, some are on vents. And the real message I want to get out to you today is that of those, the majority of those in the hospital and almost all of those on the ventilator and in the ICU today are unvaccinated.
41% of Georgians have received the COVID-19 vaccine. However, in our 13-county public health district, around 34 to 35% have been vaccinated, according to Dr. Jimmy Smith with the Bibb County Health Department.